Tab Media's special report on helping children process news related to a school shooting. Joining me is Dr. James Flournoy, a mental health professional with Brookwood Baptist Health in Birmingham. Thank you for joining us.
Absolutely. Good to be here.
Well, we are about 24 hours out from hearing the news out of Robb Elementary in Uvalde, Texas. So parents are already dealing with this topic and have already been chatting with their children, but help us understand maybe how you would suggest parents begin to help their children process and then continue to do that through the coming days.
Yeah, absolutely. So I think the thing to be aware of is that number one, you have to give an age appropriate message. So how you talk to your 5-year-old about this is going to be different than how you talk to your teenager about this.
Okay.
And so, say, for example, if you're dealing with a very young child, like say a little bit below elementary age, like 6 or younger, the real thing you want to focus on, what is the take home message? And you have to keep it simple, like, a sentence or two. So something along the lines of, if they come home and they say, hey, mommy, I heard something about something happened in Texas. What was that whole thing about? A very simple message that sort of communicates on an age appropriate level may be someone who was really angry and had trouble dealing with their anger, hurt a lot of people, right? Very simple, very concise message, not a lot of, technical jargon or terms or anything like that that could be confusing. Just on a very age appropriate level, that might be how you begin to talk to them. And really, that's probably all you need to do with someone that young. Versus if you're dealing with someone that's older, like a tween or a teen,
Right.
you can't always, because kids being teenagers or tweens may not come to you directly and say, hey, this is how I'm feeling about this. So you may have to open up the conversation, something along the lines of, have you heard about what happened in Texas? There has been a shooting, and how do you feel about that? Are you okay? What are your thoughts or what are your feelings about that? And that's just a very open-ended way of kind of getting at opening those lines of communication for them and then letting them give you some feedback. And the whole thing is, whether you're dealing with someone younger or you're dealing with a teen, the important thing is to be honest, is to listen, try not to be judgmental when, like especially your older child expresses their thoughts to you. Just sort of listen and be compassionate and, try to give them, again, an age appropriate message. If you're dealing with an older child, they may kind of start talking about, so what do we do about this? And it's okay to say, I don't know. This is very complex. It's a very complicated social issue. You have very strong beliefs on either side. And I can't honestly tell you, what to do. I can tell you how I might feel about it. I want to hear how you feel about it. If there's some ideas that you think you have about how we could, deal with things like this in the future, what are your thoughts on that? So again, it's just you're opening up and kind of making it a conversation and making them more comfortable to talk to you.
But a lot of them are still going to not want to answer. How do you feel? Are you okay? They're going to be like, I'm fine, I'm okay, or they're not going to talk. How far do you push and pull in that situation?
Well, I think it's the type of thing where you don't push too hard. So if your child does say, hey, mom or dad, I don't really want to talk about that, and your child better than anyone. And if you really feel like the conversation is not going to go any further, they've kind of dug their heels in and they really don't want to talk about it, I think the important thing to say at that point is, well, hey, I could understand if you have some feelings about it. I mean, it really is a tragedy. A lot of people have some very strong feelings about it. And I'm sure you have some feelings about it. If at any point you want to talk to me about how you're doing or about how you feel about it, I have an open door, So you leave the door open for them to talk to you. And then at that point, if they're still resistant to talking, then I think at that point, you just monitor their behavior over the next several days and weeks and kind of see if you see any changes that signal to you that they may be having a hard time coping and dealing with things.
What would be some of those signals?
Yeah, absolutely. And the thing about it is that some of the same things that you may see in your child, you may see in adults, right? So anything like, trouble sleeping, trouble concentrating, an increase in like fear and anxiety. Your child may say, mommy, I don't want to go to school tomorrow.
Right.
Okay, that might be an indication. You might need to engage them in some conversation to figure out, okay, well, why are you not wanting to go to school? Does this have anything to do with that shooting that happened the other day? And that might open up a little bit more communication about how they're really feeling at that point. But anxiety, like I said, even things like physical symptoms like headaches and stomach aches that kind of start popping up all of a sudden may give you a clue that they may be dealing with some worry and they can't express it directly, but it's kind of expressing itself in physical form. So and if they say, I'm feeling sad, if you notice that their performance in school is dropping a bit, if they aren't as dialed in, if your child is normally bringing home A's and B's and then all of a sudden they make a C or a D on the next test, that's something that you need to keep your eye on, because it could be a clue that they're having a hard time coping.
Mm, mm. And so, in most cases, just being able to talk about it and express it and work through it as a family will move them through, I'm guessing. But in some cases, that may not be true. When do you know where you need extra help?
Well, and again, I'm going to kind of
Hmm.
say the same type of thing for a child as I would as an adult.
Hmm.
And depending on how old they are, that kind of depends on what types of concerning behaviors that you may see. Like, say, for an example, if your teenager starts kind of expressing feelings of hopelessness and despair, if they kind of make concerning comments, we live in the age of social media now. And so, right, and some parents maybe monitor their children's social media accounts. So if you see them start leaving a lot of emojis and things that are sad faces, and
Right.
and maybe they start liking someone on Twitter who kind of has different views than they normally would kind of align with, kind of pessimistic and negative
Yeah.
views, and all of a sudden they start liking texts and following people like that. That could say, hey, there's something going on, and we may need to at the very least have a conversation, and maybe we need to seek more professional help. If again, feelings of hopelessness, if someone starts doing more risky things, if your child, or you have an adult friend who all of a sudden you get in the car with them and they're driving more recklessly,
Mhm.
they start getting a couple of speeding tickets, and normally they have a spotless driving record.
Mhm.
Something's going on there, and now you're starting to introduce the possibility that not only is something going on, but that they could do something harmful to themselves or somebody else, not necessarily intentionally, but those are kind of signs of some dangerous types of behaviors that we would definitely want you to seek out some help at that point.
Mm. Well, and it almost circles back to your very first point of someone with extreme anger issues taking out the anger in a way. Um, and then that's the mass shooting. But then people trying to process the mass shooting have issues, emotions that are not dealt with, and then they end up taking it out on in some way. It might not be the extreme, but then there's just this effect that just keeps happening.
Right, and that's another warning sign. If your child is normally pretty docile and happy-go-lucky, and then
Mhm.
all of a sudden they start, smacking their little sister,
Right.
or doing aggressive things that are not within their character. Again, that's a warning sign. Something's going on with them that you need to get to the bottom of. They may really be having some trouble processing and dealing. And
Mhm.
so again, as a parent or as a friend, if we're talking more of an adult or a colleague, the important thing is that's not the time where you just kind of sit back and just let that continue to go. You
Mhm.
need to say something to them, and try and open up some communication. Hey, you're doing uncharacteristic things. You're doing some things that just aren't like you. What's going on?
Mhm.
You know, and you may have to prime that pump and be a little bit more specific. Again, I can't help but think that schools, you have not really been acting the same since that school shooting, and you haven't really been talking about it. But
Mhm.
I'm noticing some things that are different with you, and I'm really concerned. And what's going on? Kind of in a matter of fact, supportive way. You don't want to kind of come across like in a state of high anxiety, especially with kids, because they can pick up on your anxiety, and then it just kind of feeds the whole thing and makes it that much more of a deal. So you have to try and, kind of check your own feelings and come at them in a supportive, matter of fact, but very affirming and very supporting way.
Right. So, well, how does this speak to the importance of actually knowing your child and being an intimate level so that you do notice when something tweaks and changes? You do notice that their emojis are a little different. Does that play in here?
Yeah, no, absolutely. That's a foundation thing,
Right.
right? In terms of your relationship with your child and knowing just, on a core level, how they tend to operate, how they tend to do things, and most parents know their kids,
Right.
right? Maybe not in and out 100%, especially when you have a teen, because they start, being a little more secretive about things and masking their emotions and feelings. But again, you kind of have a baseline in terms of how they normally go about doing things. So if you start seeing things that deviate from the norm, then again, that's something where it gets your radar up. You don't necessarily have to sound alarm bells, but if it persists, if it goes on for longer than, say 4 to 6 weeks or so, you continue to see this change in behavior and these things that are uncharacteristic and concerning, that's definitely a flag
Mm.
that you need to look at.
Well, and I think about too on that, through the years, I've witnessed or heard or seen things happen where an older teen who is battling something and very angry, and then again, we look at what's happened recently, um, and the parent, or many cases, a grandparent raising a child, it tries or does know, but doesn't really know what to do because that teen is just old enough or just strong enough to be very aggressive back toward the authority figures, and almost intimidates or pushes back on the person.
Yeah.
Do you have any suggestions for if there's a family out there that might be, they know something's wrong, they know they need to do something for their child or
Mhm.
grandchild, but they just are in this, they're caught and just kind of in this situation where they can't get through to him or her?
Yeah. Well, suggestion number one would be, because let's face it, kids, we're not the only influences of our children, right? So parents are, you can make the argument that they're the most important resource, but kids have friends, they have social groups, they have other people that they connect with and that they feel respect for and that they, associate with.
Yeah.
And so it kind of goes back to that whole notion of a village raising a child.
Right.
So right, if you are not, if you're kind of blocked and stonewalled in terms of being able to communicate with your child, well, who else is influencing them?
Okay.
Who else can you connect with that maybe can help you get on the inside to give you some insight? So that's where you may, if your child has a good friend and that friend on some level, and you can, say you just pull that friend aside and say, hey, I've noticed he's acting a little bit differently. Have you seen the same thing? Has he talked to you about anything that I need to be aware of? And same thing, clergy members, other family members. I mean, all kinds of people are within that child's orbit that you may be able to get some additional information from just by asking questions and saying, hey, I'm keeping my eye on him. Can you keep your eye on him or her too, so that we can kind of compare notes and make sure that there's nothing that we need to do further.
Right.
And if that doesn't work, again, there's mental health. There are folks like me, mental health professionals that are trained to work with, to identify and, these warning signs, and to try and help work with whoever we're dealing with to help them open up, talk a little bit more, get to the root of what's really bothering them and see if we can give them some better strategies for coping. So making an appointment with a mental health provider, if you feel like that's appropriate, so that then they can talk to somebody in a fairly non-judgmental, safe environment. A lot of times kids and other adults, again, may not feel comfortable talking to family for whatever reason. Maybe they feel like they'd be judged or that they would not be understood. So I think our primary role as parents and friends is to communicate that, number one, hey, whatever you say to me, I'm not going to judge you. It's okay to talk, kind of try to set that tone for them yourself. But if that doesn't work, then option two is, okay. And again, like we said, if the symptoms are severe enough and you're concerned enough, you may kind of bypass the parent talking stage and just say, hey, this is a little bit bigger than me. I'd feel more comfortable with you talking to somebody that knows a little bit more than I do, that can help get to the bottom of things and just make sure you're feeling okay again.
Yeah, I see how that could be important for sure. But I also know that the mental health industry is overwhelmed at the moment. And sometimes trying to call and get an appointment is going to be 2 and 3 months out. What if it's a little more of a crisis situation?
Well, depending on how much of a crisis it is, like say, for example, if you have some pretty strong indications that that person is thinking of hurting themselves, I'll just use that as an example.
Right.
Well, we know we have the National Suicide Crisis Line, so that would be an option to call. Off the top of my head, I don't know it, I don't have it,
I'll put
but it's
that in
something
the
that you
show
could
notes.
easily Google.
Yeah, I'll put that in the show notes as well.
Yeah, right. So that would be one option. And again, there actually are, like, say, for example, depending on the age of that person, if there's an imminent crisis, like, say, for example, an adult, you can take them to the emergency room if you really have a suspicion that they're, about to do something harmful to themselves or someone else, or they're in a rapid state of deterioration, and take them to the emergency room. That way a doctor can kind of lay eyes on him or her and help you determine in a very quick way, how do we need to proceed to deal with this?
Okay.
Right. So, even children, right? I mean, you kind of have the children's versions of emergency rooms and specialty clinics and those types of things, and you absolutely can kind of take them there. So someone with some training can lay eyes on that situation and help you determine what's the best course of action from there.
Okay, that makes sense. Well, we've been talking about children a lot, and you have mentioned adults throughout that. Back to the school shooting, we're all trying to process it. Are adults going to handle it differently? Are there any different tips, or would they be similar for what we've been talking about?
They'd be actually really similar in
Yeah.
terms of dealing with children versus dealing with, say, an adult friend or a colleague or a family member. Again, if you're noticing uncharacteristic things, and some of those symptoms, like I said earlier, may be the same. Like, say, if it's a work colleague and all of a sudden you notice that they're like, say, if you work in a hospital and you're a nurse and you notice that one of your nurse colleagues, and normally she can do an IV line like that and without blinking, and then all of a sudden she's struggling and not on her game as much usually. Okay, that's something that you want to keep an eye on. Something's up with her, maybe, or him. And again, if they're endorsing feeling sad, if they're saying, I just, that school shooting or whatever it is, I just can't get this particular thing off my mind. If you notice, if they say they haven't been sleeping well, if they say that they're feeling more anxious, more fearful, something like, I don't know, an example would be, because a lot of folks are working from home now, but like, say, for example, you have a colleague and they've been coming to work every day, and then all of a sudden this tragedy happens, and you notice that they just seem a little bit more kind of uptight and fearful, and they say, you know what, I think I may just start working from home now. Again, that's sort of a change that says, okay, what's actually going on? How are they processing and dealing with this? They sound like they may be having some problems, kind of coming to grips with all of this, and it may be on the verge of changing their behavior. That's something that would get my radar up, and I think it should get your radar up. And it's worth the conversation at that point. Again, hey, are you okay? I've noticed some things that are a little bit different about you. I'm just, want to check in with you to see how you're doing. There's actually, and I know you've probably seen the commercials. It's a pretty popular commercial, right? It's I think it's an advisory council commercial on mental health, and they kind of go through like all the awkward ways that people, when they want to have these conversations about mental health, and they're kind of hemming and hawing and beating around the bush. There's actually, but I think it's I can't remember what the website is now. It's something about embrace the awkward or something like that. But right. I mean, it kind of gets at that whole phenomenon about how difficult it is having those types of conversations. And it's actually a really good website. I was on there today about just what are some of those ways that you can open up a conversation? What are some of the things that you can say when you notice that things are not going well or that they're different with someone? Yeah, I'm sorry. I wanted to try and find that link, because I know somebody's going to ask about it and want to check that out. And it actually is seize the awkward. I made a little note for myself, seizetheawkward.org. So it actually goes into that website, has warning signs, talks a little bit about warning signs for like depression and stress and anxiety and those types of things, and ways that you can open up conversations and just kind of engage that person where they are. So if somebody wants more specific, kind of a little bit more detail in terms of some of those strategies, that would be like a good site to go to.
That's good. I'll make sure I put that in the show notes as well. You're giving us good tips and resources for sure. Okay, so I have a question. We're in media here, so we're always doing the coverage and staying in it, and we have to kind of watch our own consumption, because it can really take us down. What kind of balance would you suggest for families as far as watching the news and listening to these reports in the home?
Yeah. And again, there's sort of an age appropriate factor to this. So if you have really young kids, you really don't really want them watching much of it at all.
Okay.
Because especially at that age, pictures and images can really resonate with them and stick with them for a long time. And it just can be very uncomfortable for them. And so you really, again, on an age appropriate level, you may really just not let them see too much about those stories. Now, the bottom line is we live in an age of media consumption. They're gonna, sometimes they just get a hold of it and we don't even plan on it and we don't even know. But then the point is trying to balance that out. So, for every image that they may see that involves panic people running or people on the ground or, people crying, you want to try and balance that out with, okay, but here's some positive. You see how all these folks are hugging and coming together. You see people in the community doing things for each other and embracing. You want to always try and infuse a little bit of positive in there. And that's really on a young child level or even older, right? You don't want to just let yourself completely focus on the negative. And so when you have more control over how much media consumption that you have access to, you definitely want to limit that. That's where you have to be self-aware and monitor how you're feeling. And if you're looking at coverage and you notice that you're just starting to feel tense and you get the lump in your throat, you start getting angry, hey, turn it off. Turn it off. You don't need to watch wall-to-wall coverage. You don't need to stay up till 2 or 3 in the morning to get the latest little tidbit. At some point, you need to limit yourself and say, hey, that's enough. And try and do things to balance and your life out and do healthy things. So kind of get back to some of your habits, whether it's meditating or working out or having a good meal. I mean, try to infuse a little bit of positivity and normal routine stuff to counterbalance all that negative stuff that's being, pitched to you in the news cycle.
Well, and I can see, as people of faith, prayer is so important, and how we could easily stop focusing on our prayer life and just be fretting and trying to watch more news and try to get those extra pieces. So trying to make sure, we keep that, all of those balances. And and I like what you said, to try to get back to your routine. Is it okay to have your routine life when crisis is happening all around you? I mean, it
It's
seems
vital.
wrong, it just seems wrong.
No, it's absolutely vital, because when you think about tragedies and traumatic things that happen, that upsets our sense of predictability in the world. We like to kind of think how things go and that things are fairly predictable. So when shocking, traumatic things happen, it upsets the apple cart. And we really then feel out of control. And sometimes that makes us feel more jaded and more angry and all of those types of things. And so just kind of getting back to your normal routine helps stabilize that a little bit. So you want to have your normal routines. And when you're talking kids, you have to be prepared, because sometimes you may see some changes in them. Like, say, for example, if you have really young kids and all of a sudden after a tragedy like this, they become a little bit more clingy. That's normal. That's expectable. And so you may respond with, hey, let's make sure that we have at least one night out of the week. If you aren't already doing this, let's have a family night where we spend some time together, or we go someplace and do something fun, right? Because again, you're trying to make things, and let's do that every week for a little while, trying to make things predictable, trying to kind of inject some positivity. You may have to give an extra dose or two of hugs and just pats on the back and reassuring, shoulder, grab them on the shoulder. Hey, everything's okay. Small, subtle things like that, though, reassure that person that, hey, everything will be okay. Hey, there's still some good in the world. There's still positivity, and we can get through this. So those are the messages that you try to send. Life is still going to go on. We can acknowledge that bad things happen. We can acknowledge that we feel pain and we feel, fear and all these other negative emotions, but we're not going to stop. We're going to keep going, and we're going to lean on each other. And that's what we do. We're resilient. That's kind of what you want to send that bottom line message as.
Yeah, a message of hope too.
Yes. Yes,
It's not
absolutely.
hopeless. Yeah. Wow. All right. Well, thank you. Thank you. We will have a lot of information in the show notes, but I'm assuming too, if someone doesn't know where to go to get help, they could start with their doctor if they have a medical doctor, and or like you said, the emergency room if all else fails. But we'll have a lot of links in the show notes to help as
Yeah,
well. Any
great.
last
Great.
thoughts you'd like to share?
No, overall, again, this is just, we're going to go through trying times, and we're at one right about now. But again, take home messages, kids, adults, we're resilient. We get through things. It's okay to temporarily feel off balance and feel upset. That's normal, but we're going to get through it. Lean on each other. Be positive.
Well, Dr. Flournoy, thank you.
All right. I enjoyed myself.